My name is Pradeep Mohan. I'm a plastic and reconstructive surgeon at Central Texas Medical Center and Live Oak Health Partners. We have been actually here for about 3 years, and we've been doing a number of things in both cosmetic surgery, reconstructive surgery, and hand and microsurgery. We also work with burns and patients who have had any kind of complex trauma of the head and neck, as well as wounds. So we kind of run the entire gamut of plastic surgery. The most important part is actually listening to a patient first. Patients don't realize that they can actually diagnose themselves much more than anybody else. So if we can actually just listen to our patients, understand exactly what their needs are or what the problem is, more often than not we'll be able to come up with a good diagnosis and a good plan how to treat them. The other part of that in patient care is understanding what their limitations are as patients. A lot of patients have other limitations outside of just their medical condition. And we, as physicians, become a little bit too focused on just what the medical problem is, but we don't pay attention to other issues that may actually be a part of their medical condition or that may affect how we can help treat their medical condition. Examples for patients who have a lot of stress and diabetes, that it will change their sugar levels. For us in surgery, it could be either financial or family issues or other things that are involved that limit what they would be able to do after we actually do something surgically for them. So if we can actually hone in on exactly what the patient's needs are, not just from their medical standpoint, but from a familial standpoint, we actually have a far better success with them overall in treating them with their concerns. That's the first part of my philosophy. The second part is just making sure that we take care of them the best we can. Patients they have a faith relationship with us helping take care of them and treating them, and so the most important part is if they have that trust in us, to make sure that we're deserving of that trust, and we do everything we can to make sure that they are well taken care of. I'm married to the most wonderful person in the world. I'm extremely lucky. Sumedha is my wife. We've been married for a little over 18 years now, 18 and a half years. I have 4 munchkins, which are 2 girls that are oldest. One's 15 years old and one's 13. We have 2 younger boys, one's 8 and one's 5. And we just have a new addition, which is a purebred British Lab that is now 10 weeks old, and we got him when he was 7. So that's our entire family in a nutshell at this point. We were trying to shoot for that other dog, but my wife said, no, I think one's enough for now. But it's been, I'm actually been very, very blessed because my family's very understanding about what I do and the constraints it has on my time. So I've been actually very blessed in that regard. And they're wonderful to be with. So I have a great time with them. My hobbies a lot of them have gone by the wayside for a while, since I've been pretty busy with the grace of God. But I think that if I could do anything right now, it's just spending time with my family as much as I can. So playing with my boys, actually doing any kind of sports activity with them, playing with the dog and my children is a lot of fun. We have a family thing we do together. It's kind of a little bit different, but we have family Call of Duty time. So we are there all playing Call of Duty at the same time against each other, as well as against other people. So that's really been our family.